Hello, welcome back. We're going to go through chart 7 for the abbreviations. And I posted some of the videos already for some of them that might be a little tricky to remember or are kind of important for you to really know what they are and are difficult for me to explain in a video. So I did choose some of those. They're already up on iLearn. So L for liter, this is a unit of volume. Generally, we buy pop, like soda, in 2-liter portions, right? But also a liter just literally means 1,000 milliliters or 1,000 cc's, which is cubic centimeters. Lab, this is short for laboratory. A laboratory is a diagnostic medical setting. This is generally where they process specimens, like blood work, urine, fecal matter, that kind of stuff. LAT, this is lateral. Lateral is a directional term. Okay, it means side. Okay, like your arm is lateral to your chest. Right? If something is unilateral, it is one-sided. Okay. LB, this is pound. Right, this is how in America we measure weight. We don't use kilograms. Generally, we use pounds. But the trick is in medicine, we still use kilograms to calculate dosages for medications for children and painkillers, that kind of thing. And we have to convert it from weight in kilograms. All right. Long-term care, LTC. So this is like assisted living or nursing home. This is generally where somebody has to go to live for like weeks, months, possibly years. LDL, this is low density lipoproteins. It's the unhealthy cholesterol, but too much of any type of cholesterol is a bad thing. So, but generally low density lipoprotein has worse effects with elevation than HDL would. LG, this is large, right? We've seen this probably when we order a meal at a fast food place. You can, get a large size drink or a large size meal, large size fries. This is also going to determine size for clothing, small, medium, large, right? LIQ, this is liquid, like water is a liquid, soda pop is a liquid, saline solution is a liquid. LLQ, this is for left lower quadrant. This is from the patient's perspective, the anatomical position. Left lower quadrant, LLQ. Last menstrual period, LMP. This is generally how they determine a preliminary due date for a baby is based off of the last menstrual period date. Also, this can kind of help determine the beginning of pregnancy, right? Because if it's been more than a month since the last menstrual period and the patient has been sexually active, it is a possibility that they could be currently pregnant. LOC, this is laxative of choice or level of consciousness. So I'll start with level of consciousness because it's a little more important. Patients LOC, they could be alert and oriented ×1, ×2, ×3, ×4. Right, so they could be alert to person, place, time, and event. If they are unable to answer questions related to any one of those, they are considered altered, which is where they're not in their right mind. That means something is definitely wrong. Laxative of choice. Okay, laxative is something that helps you to poop, helps move your bowels. Okay. All right, LP, this is a lumbar puncture. So the lumbar region of your body is in the lower back. A lumbar puncture is where they take a needle and they stick it into the space around your spinal cord, and they get cerebral spinal fluid out from that. It's a this is generally how they will administer an epidural as well. That's what's given to a woman in labor with a baby to kind of help block the pain from labor. LPN, this is going to go kind of hand in hand with LVN, so licensed practical nurse or licensed vocational nurse. So this is kind of on the step below an RN or a registered nurse. So they don't go for a full associate. They'll generally have um, a certificate for this, but they can do probably at least 3/4 of what nurses can do. They can give medications, they can do certain procedures. However, an LVN or an LPN does have to work under a registered nurse. MA, this is a medical assistant. Medical assistants can work in a variety of ways. They can specialize in specialties of medicine. They can learn how to do procedures like give injections, potentially start IVs, do EKGs, all sorts of stuff. And you can get a job as a medical assistant without an official medical assistant certificate, but you'll make more money if you have that certificate. Okay. MAT, this is maternity. Maternity refers to the time when a woman is pregnant, right? Like you've probably heard of this with maternity clothes. These are the clothes that pregnant women generally have to wear because their belly is so big that it doesn't fit into normal regular clothes, right? So these clothes are meant to fit women with a larger belly. Maternity. Microgram. This is a very, very small portion of a gram, which is a unit of measurement of mass. And we can measure some drugs in micrograms, especially when a very little bit goes a very long way. MD, now I posted a video on muscular dystrophy, so I hope you've referred to that. There's a few different types of muscular dystrophy, but ultimately they lose control of their muscles, and it can happen over a very long period of time. And they lose function throughout their lives. Medical doctor, that's an MD, right? That one you've probably seen on your doctor's sign in front of their building, their office. Myocardial disease. Myocardial refers to the muscle of the heart. So this is where you have dysfunction with the muscles of the heart. Med, this is short for medical or medicine. Like you can ask a patient if they have taken their meds today, which is their medicine. MG, when it's both lowercase, okay, this is for milligram. Milligram is also a unit of measurement of mass, and we use it to measure medication. So ibuprofen is measured in milligrams. So you can get 200 milligram tablets, you can have 600 milligram tablets, 800 milligram tablets, right? Depending on what dosage level you need. Capital M, lowercase g, this is magnesium. This is an element from the periodic table. It kind of is a little giveaway when it's a capital followed by a lowercase. And magnesium is primarily responsible for the action of your muscles. If you don't have enough magnesium in your body, your muscles can spasm, or you can have just a generalized weakness of your muscles as well. It's magnesium. Mi, This is myocardial infarction. This is a heart attack. So during CPR and first aid, I talked about cardiac ischemia, right? When you have cardiac ischemia, that is a myocardial infarction, an MI. NICU, this is a mobile intensive care unit. It's kind of like the step up from a critical care ambulance. And they have ultimately everything to keep a patient alive over long distances. So it's a lot of specialized equipment. You have to be specially trained, to work on a MICU. Okay. Sometimes they have nurses that work on them. Sometimes they're critical care trained paramedics. Okay. MIN, this is minutes. It's a measurement of time. Generally, we measure like pulse rate in beats per minute, or respirations in respirations per minute. Consists of 60 seconds. All right. Milliliter. This is a unit of measurement for volume. A milliliter is equal to 1 cubic centimeter. Okay, 1,000 milliliters equals a liter. Medical lab tech, I have a video posted for that online. Millimeter, this is a unit of measurement of length. Millimeter, also centimeters, meters. Okay, millimeters can measure, how long an incision is or how big a lesion is in the body. Okay, it's not a huge measurement. It's very small, but it's still small, or excuse me, it's still large enough that you can see it with your own eyes. MOD, this is moderate, as in not light, not too much. It's moderate. It can describe how severe a condition is. It can also describe quantity as well. MOM, this is not mom like your birthing mother, right? This is milk of magnesia. Ultimately, it's an ingestible form of magnesium. We generally take milk of magnesia to help soothe our GI muscles, to help us use the bathroom, kind of almost like a laxative, or to soothe upset stomachs if it's caused by a dysfunction of the GI muscles. MRI, I have a video on that. It's a form of imaging, so we can see what's inside. I posted a video on multiple sclerosis and mitral stenosis, but MS can also mean musculoskeletal, meaning the muscular skeletal systems, because your muscles and your bones work hand in hand in order to provide structure, support, and allow your body to move. Medical technologist, that's MT. I posted a video kind of comparing and contrasting what medical lab technician and medical technologist is. And capital-wise, this is nitrogen. There's nitrogen in the air. You can use liquid nitrogen in order to freeze things like warts. N/A, this is not applicable. So there's a lot of things that can happen in medicine, and when you're doing your reporting, sometimes you have to put that something is not applicable. Like in my reports, it always asks me if, how many patients I have, and also if it's a mass casualty incident. A mass casualty incident is where you have multiple patients at one time. And if I have one patient, a mass casualty incident is not really applicable. Capital N, lowercase a, Okay, a capital followed by a lowercase. This is kind of indicative of an element from the periodic table, sodium. You have sodium levels in your body that help produce energy. And it also helps with liquid and pressure regulation in your body as well. But sodium comes from like table salt, if you have salt in your food. Those can all contribute to your sodium level in your body. NA, this is a nurse aide or a nurse assistant. You can have a CNA where they're certified, but ultimately they help take care of the patient's daily needs, clean them up if they have to use the bathroom, assist them in walking if they need it, make sure that they have everything they need, they're taking their medications the appropriate way, but they are not allowed to dispense the medications to the patients. That has to come from a specially trained CNA, which has a certificate in medication administration, or it has to come from an LPN or LVN or an RN or a physician, something like that. So I mentioned sodium earlier. Sodium chloride is actually the chemical formula for table salt. So NaCl, that is an L, not a capital I, that is a L. And that's actually what you sprinkle on your food when you want to season it. So I hope these made sense. Let me know if you have any questions. You can email me or shoot me a message on Remind. And we'll pick up with finishing up chapter 14 for the week. And we will have that test on Monday. So we'll do a little review before that and get through chapter 14 so that we can begin chapter 15.